Wylde on Health. Excellent digestive health is imperative, of course, to your overall health and well-being. Simple changes in your daily life can lead to major improvement in the quality of your digestive health. That's the topic of the show today, irritable bowel syndrome, leaky gut. We're here with Dr. Bested and Dr. Trotter. And, you know, let's start with you, Dr. Bested, because at the break, we're talking about, hey, wait, let's take a step back here. Let's get back to the KISS model.
Back to basics.
Right, back to basics. So, you know, again, what should everyone be doing in terms of, you know, diet for good health?
Right. Well, we need to eat sensibly. You know, have adequate protein, carbohydrates that are complex, low on the glycemic index, which means they have a lot of fiber, and some, you know, nutritional oils. So with patients who are particularly constipated, and often when you have constipation, you do have some diarrhea, which means the stool actually goes around a lump of constipation, and then you get this alternating constipation diarrhea, which is usually, for the most part, more constipation. So how you approach constipation is you make sure the person has adequate water, so that you make sure that you have enough to basically float the stools through and to expand them, and also fiber to hold the water in place. Yeah. So you have a nice bulky stool, and then you need something to help push it. And the pushing can come from increasing simple things like magnesium citrate, or vitamin C. And those kind of combination of things, higher fiber foods or adding additional fibers. So there's one here, for example. This fiber is helpful, but there's lots of other fibers. You can grind up some flax seeds.
Love golden flax.
Absolutely. You know, or, you know, make sure you have the apple a day, keeps the doctor away. Well, that's absolutely true.
Pectin, right? I mean, it's soluble as well as insoluble. You want the insoluble, the stuff that's not going to get into your arteries to help lower cholesterol. That's the soluble. The insoluble to stay there, draw and bring water, the magnesium, the vitamin C. Dr. Trotter, your favorite supplement when we're addressing this? I mean, there's multiple ones on the table, but we'll get back to calls.
Yes. So as a general rule, anti-inflammatory supplements is always a good idea in leaky gut syndrome. But my favorite that's specific to leaky gut is L-glutamine. So that's an amino acid that's one of the most common amino acids in the body. And what that does is it actually fuels the enterocytes, or the cells lining your digestive tract, and helps to make them tighter so that the permeability decreases and you achieve a state of a better permeable gut.
L-glutamine, is that pretty widely available?
That's pretty widely available. Often this is also used, so it's generally speaking, glutamine is used for digestive tract health and also muscle mass. So you'll even see it at some supplement stores like Popeyes for people who are trying to build muscle. But it's also used in cachexia patients, people who are wasting from cancer, HIV, and things like leaky gut.
Right. Excellent stuff. Well, let's go back to the phone lines and see what people are saying. Louise is calling in from Brampton. Louise, welcome to Wylde on Health. How are you this evening, Louise?
I'm fine, thank you.
Good. Go ahead with your question.
Yes, I was diagnosed with H. pylori a couple of years ago, and I was put on Period for a period of 6 months. Now I've got the same type of symptoms, very severe cramping, bloating, and it's so severe that they have put me back on that in hopes that that's going to clear it up again. Is there anything in a natural way that I can help this so that it doesn't keep reoccurring?
There sure is, and let me ask you first before they drop the phone, you know, first of all, H. pylori can reoccur. You know, most of us have some degree of it in our systems. It's an opportunistic bacteria that takes advantage of you when generally your status within your gut is not optimal. But have you gone through triple antibiotic therapy or had any other sort of to kill the bug, other than the Period to lower or suppress the acid?
No, the only thing that they've put me on is the Period.
Okay, so let's talk about treatment here. Okay, so let me start with you, Doctor.
Yeah, so I think the most important thing is if you could do the triple therapy, which is the combination of the...
It's a stubborn bug. I mean,
it is.
I don't know what Dr. Trotter will say, but I am absolutely not opposed to antibiotics when we're talking about H. pylori.
And I've never had any success seeing patients after they've seen a naturopath. So I usually end up using, you know, several antibiotics that are specific ones for this, and you can look it up in their CPS, basically, and you have to have an acid suppressant as well. And I also combine it with the Pepto-Bismol, which is one of the older versions of how to treat this. And in my experience, it takes usually double the amount of time. So 1 week does not do it. Usually it takes a minimum of 2 weeks of doing this, plus taking a probiotic to put the normal intestinal bacteria back in. And I think that's the essential part that's often missing.
Absolutely. Yeah. What are your comments? Have you had success with H. pylori?
Yeah, I'm not opposed to medication when it's the right circumstance. So sometimes you do want to treat the bug and eradicate the bug, but also there's a lot of things like herbal mucilaginous herbs, which help to heal the mucous membrane lining of the digestive tract or the stomach, which is an important thing when you're trying to deal with someone with acid reflux.
So we're talking, when you say mucilage, we're talking slippery elm,
elm, licorice,
okay.
plantain, that sort of thing.
Okay, great.
And the licorice is the not glycerized licorice.
That's right.
Yes.
Yeah,
because
that can raise blood,
it raises
blood
blood
pressure.
pressure.
Yeah,
right.
that's a very important point. And also, let's just talk quickly about the, the testing. For Louise to go and get retested, a good doctor should know not to test blood, because these antibodies, even though she's presenting symptoms,
Yes.
these antibodies can stay on, linger on for a couple of years
For a long
after,
time.
right?
So I would
breath.
suggest the H. pylori breath test,
That's right.
which is unfortunately not covered by OHIP. It costs, I think, about $70, but it's well worth every penny, because you need to know if this is H. pylori or is it something else.
Time flies when you're having fun. We only have 30 seconds left. Talk to us about, a couple more products there, real quick and dirty, before we have to go here, Dr.
So
Trotter.
oils, and I was talking to Dr. Bested earlier, essential fatty acids is an important thing for general health. It prevents a lot of disease, and there's a lot of research that determines that it prevents a lot of cardiovascular disease, mental health, and it has a lot of anti-inflammatory effects as well. So whenever there's symptoms, there's inflammation in the body, and we're always trying to get the inflammation down based on our North American diets.
Excellent.
So adding a good quality, high potency, high EPA, DHA fish oil is an important thing to add to a supplement regime.
Good stuff. Thank you both so much for joining your wealth of information, the two of you guys. Up next, I'll share with you my health notes. Don't go anywhere.